setting boundaries with an adult child who has a mental illness. You know, more and more today, I am hearing stories from parents who have a child who is really struggling with some type of mental illness, bipolar disorder, major depressive disorder, an anxiety disorder, PTSD, obsessive compulsive disorder, ADHD, and maybe even schizophrenia or borderline personality disorder. And I'm having these parents come to me and saying, help, you know, what are my boundaries? How do I hold an adult child accountable when that adult child also struggles with a mental illness? It isn't just the acting out, it isn't just the drug use or the alcohol use or the irresponsible decisions. It's the underlying mental illness that might be contributing to those things. Statistics tell us that people that have mental illnesses use substances in order to kind of mitigate the mood swings or the highs or the lows or the feelings that they have that come along with these mental illnesses. When you're anxious, you drinking to calm your anxiety down kind of makes sense if your medication isn't doing it. If you're depressed, taking something that makes you feel less down and less sad kind of makes sense. Or if you're in a lot of pain, taking substances that just kind of numb you and take you out makes sense too. So the statistics show that people that have mental illnesses are really at high risk of also using substances. Even ADHD, because of the compulsivity and the impulsivity, you have a high use of substances. So how do you make these difficult discernments? And it truly is a discernment. It's taking all of the facts, all of the factors, and looking at them and coming out with a best solution or best option. And it isn't going to be treating that child like you would treat a child who has no mental illness at all. Now, there is always the question, what came first? Was it the drug use or the alcohol use that caused the depression, that caused the anxiety? Well, certainly those things do contribute to it, do sometimes make it worse. Sometimes you might not even be able to figure out what came first. So all in all, you're going to take both into consideration. When somebody has a problem like a mental illness, you're going to not excuse that person for not dealing with it, and you're not going to excuse that person for not doing what he or she could do, and you're not going to say, oh, well, they have no choice, no hope, or no possibilities. You're going to hold them accountable for what they are capable of, and you're going to hold them accountable for the choices that they do make. But there's going to be a little bit of padding of grace in there, and maybe a little bit less harshness when you have somebody struggling with a mental illness. So here are 4 questions that will enable you to figure out whether or not you should jump in and help or not help or let that person bear consequences. First question is your helping necessary? You know, we can hover even over our adult children, especially those that are, you know, mentally ill, and act like we have to do everything for them and see them as completely helpless. It's not good for them. It is good for us to expect that child to do everything possible and then a little more, not to do the reverse, which is the excuse of, oh, that child can't do anything. That will not help him or her in the long run. So you need to really assess, do I have to do this, or can this kid be pushed a little bit to kind of do this on his own, or pushed a little bit to kind of step out and risk? And then there are certain things that you absolutely want that child to do on their own. Getting a child into recovery for mental illness or substance abuse when that child has no desire to go at all means that you will most likely have an outcome to where it will not work. You want to help that child figure out what he or she needs to do on their own, so it will be at least coming from them. Doesn't mean that there's not a time when you have to intervene because things are out of control and dangerous, and you know, put somebody into the hospital for a few days or something. But you want to ask yourself, is my helping necessary? The next thing is my helping encouraging? We can do 2 things with our helping. We can encourage somebody to rise up and do more, or we can discourage the person and send them in the opposite direction, okay? So is it encouraging? If you go find your child a job, drive the child to the job, set it up with the person that no matter how that your child performs on that job, that the child keeps the job, that is not encouraging. That's discouraging. The message that you're sending is you're incompetent. You're not capable of getting a job, you're not capable of keeping a job, and you're not capable of doing what you need to do. That does not help someone. You want to encourage that person to see hope. Encourage that person to move forward and do something that's beneficial and positive that he will feel good about. You want that child to become, as much as possible, to do what will kind of push that child forward without you doing everything for them. The next one is you're helping healthy. And this goes two ways. Is it healthy for you? Actually, it can go more than two ways. Is it healthy for you? Is it healthy for the child? And is it healthy for your other relationships? For instance, let's say that this is your child and you are remarried and your spouse has different opinions. And if you do everything for this adult child with this mental illness and substance addiction, and you put that child in your home, regardless of what your new spouse says, and you continually do everything for that child, excuse that child's behavior, even mistreatment of your new spouse, you have to ask yourself, is this healthy? Is this healthy for my marriage? Is this healthy for me? Am I doing something that's good for me, or is this unhealthy? Because sometimes we, especially as mothers, or, shouldn't exclude fathers, when we love our child and we see our child spiraling out of control and we become fearful about things that could really happen, that could be really bad, then we panic and we jump in and we try to fix again and again and again, try to argue, try to explain, try to set things up. And there's a point where that becomes very unhealthy and we have to learn how to step back. And then as you're helping working. The definition of insanity is doing the same thing over and over again and expecting different results. So are you doing the same thing, getting the same outcome, or are you trying something different? There's nothing wrong with trying to see what outcome you get. So look at what you're doing and saying, is this working? Is this pushing my child towards something healthier? Is this helping that child to be accountable? Is that helping that child to be responsible? Is that sending the message to this child that you're capable of taking care of yourself? You're capable of making wise choices. You just need to do them. Is it giving that child parameters in which, for instance, you don't give a drug addict or somebody who abuses alcohol or pills cash, because that person is likely to go spend it. But if you've got a child who's mentally ill, who needs medication, you might want to spend the money for the medication and then bring the medication to your child and have your child take the medication because you know that that's good for your child. But you're not going to just give cash. There's a time for me with an adult child who has a lot of medical issues and emotional issues, fits these categories, where I pay for an insurance policy. It's for me. It's the insurance policy that I have to where if something is needed, that I won't have to cash out my bank account and my savings in order to pay for medical care if I have a child who's in need of something that I want to give that child good care. So, you just want to ask, is it working? If it's not, do something different. If it's causing damage in your own marriage and in your own home, if it's wearing you out, if you're exhausted, if having that person around is just disrupting everything else, then you might have to look for other alternatives. So these are not easy boundaries. These are not easy questions to answer, but they do help you know that when you're dealing with a child that has a mental illness and or substance abuse along with it, that you have to take all the factors into consideration and make some very wise decisions. So I hope this has helped you, and I hope that you'll look at more of my videos on Change My Relationship. Thank you.